Hi, coaches. I just wanted to talk to you for a few minutes today about the topic, what if your challenger has diabetes? As a nurse practitioner and diabetes educator, diabetes specialist, I have worked with a lot of people with diabetes. And first of all, I want to assure you that everything in our program is perfectly fine for anybody with diabetes, whether they have type 1 diabetes or type 2 diabetes, which are very different diseases. What I want to really stress to you is, well, everybody wants to know, do I need to check with my doctor first? And in my opinion, no, they don't. But as a coach, you want to ask your person who has diabetes if they are taking insulin, or if they are type 2, are they taking a pill that falls into the category called sulfonylureas? And you can look in the text for the spelling of that and Google it and see what all different pills fall in that category so that you can know if your client has one of those. The main reason for that is those pills, sulfonylurea category, cause the pancreas to put out insulin. Brings blood sugar down. Insulin brings blood sugar down. Now, what's our 21 days all about? It's to level out blood sugar and level out insulin levels of the insulin that we make normally. So besides the medicines, insulin and sulfonylureas, the other things that cause blood sugar to come down are exercise. The more physically fit and active, not physically fit, but more physically active people are, their blood sugar can drop considerably during or right after that activity. Also, we're all about low carbs, right? That's great for people with diabetes, but if that's not the meal plan they've been following, their blood sugar is going to come down. So exercise, medication, low carbs. Why is that important to stress to them? Because if they're on those medicines, insulin or sulfonylureas, they can get low blood sugar very quickly. So you just want to ask if they are on those medicines and ask if they carry something with them at all times to treat their low blood sugar. That just means a fast-acting carbohydrate, whether it's candy or milk or juice or glucose tablets that can be chewed up. They need to be carrying something on their person so that they have something always quickly available. And then you need to instruct them. If you get low blood sugar, contact your healthcare provider, whether that's a nurse practitioner, a physician assistant, a physician, or the nurse in the office, whoever they work with, or a nutritionist, whoever they work with to adjust their medication, because we want them to be able to take less medication. It's not that our program or anything is causing the low blood sugars per se. It's that when they're healthy and doing things right, they're more susceptible to getting it, and that means they need less medicine, which is always a good thing. So be sure that you find out if they're on insulin, if they're on a pill called sulfonylureas, and if so, to caution them about having something on their person that they can treat low blood sugar with. And people who have diabetes and have had a low blood sugar, they know they've had it. This is not something that's subtle and hard to identify. It's like, boom, like that. They're shaky like this, or maybe it's all shaky inside. They are extremely hungry. They may have trouble thinking. Their speech becomes slurred. Their gait may become unsteady. In fact, they act like they're drunk. They have to have some sugar immediately to bring their levels back up to normal. So we want to prevent that by letting people who are on insulin or sulfonylureas be ready for that, be prepared for that, and be able to lower their medication. And one other thing, when you have people who have diabetes that are going into your challenge, I just think it's our responsibility to explain to them that we have something else besides the complete in the program that will improve their glucose even more dramatically, and would they be interested in us sharing with information about that? And then go to your Unicity movement.com site and click on the links for, or the products for balance cholesterol and balance glucose, and send them the link, share that with them and see if they are interested in starting. Now, for those of you who have taken balance, both kinds of balance, you know that the one in the black packet is balance cholesterol, and that works, we say that's about 75% effective on their cholesterol and triglycerides and about 25% effective on their glucose. So it helps for both. And if you've taken both of these, you know that this doesn't get as thick. It's a little more, to me, more pleasant tasting, a little easier to take initially for people who have not taken a fiber supplement. Some people don't care about that at all, and they want to go right to what's ever going to be the most effective for their glucose, and that would be the balance glucose. And we say this is 50% of its effect is on the glucose, and 50% is on the lipids. So they're both effective for both. If they don't mind a little thicker consistency to start with, this is fine. It's nice if you give them samples if you have both. But of course, they can always return it and exchange it for the other if it doesn't work out. So, but let them know, excuse me, it's important for them to be aware that we have these products. The balance cholesterol is as effective as statins without any of those side effects. And both the balances are going to improve their glucose with the very first dose. So again, they need to be cautioned about low blood sugar. So I hope this is helpful. Thanks.